A very good morning, everybody. Today we will be completing with the anterior compartment of this leg, and then we will be dealing with the medial compartment and the lateral compartment of the leg. So the muscles of the anterior compartment have already been completed in the last lecture. Today we will be dealing with the main arterial supply and the nervous supply of this region. Now, the main artery of the front of the leg is the anterior tibial artery. It corresponds to the posterior interosseous artery of the forearm. The important thing here is that the blood supply of the anterior compartment of the leg is reinforced by the perforating branch of the peroneal artery. What does that mean? यानी anterior tibial artery के साथ साथ posterior जो peroneal artery है जो कि posteriorly जाएगी उसकी एक perforating branch आती है जो anterior compartment of leg को supply करती है. ठीक है. सो साइज एंटीरियर टिबियल आर्टरी और पेरोनियल आर्टरी की जो परफोरेटिंग ब्रांच है उसका इनवर्सली रिलेटेड होता है. अगर एंटीरियर टिबियल आर्टरी मेन आर्टरी होगी, परफोरेटिंग ब्रांच ऑफ पेरोनियल आर्टरी जो होगी वो छोटी ब्रांच होगी. ठीक है. नाउ जैसे हम लोगों ने हर आर्टरीज में देखा ओरिजिन क्या है, कोर्स क्या है और ये खत्म कैसे होती है. सो वी नो दैट एज वी कैन सी हियर, सॉरी, नाउ this is the popliteal artery. At the lower border of the popliteus muscle, this is the posterior aspect of the leg. At the lower border of the popliteus muscle, it divides into two branches, anterior and a posterior tibial artery. So the anterior tibial artery arises at the lower border of the on the back of the leg, at the lower border of the popliteus muscle. It then enters the anterior compartment through the two heads of the tibialis posterior muscle. It pierces the interosseous membrane and it comes to lie anteriorly. ठीक है. Then anteriorly it descends straightway between the medial and the lateral malleolus, and then on the dorsum of the foot its name changes and it becomes the dorsalis pedis artery. इतना आप लोगों को इसके कोर्स में याद होना चाहिए. ठीक है. सो कहाँ पे शुरू होती है? वन ऑफ द ब्रांचेस ऑफ द popliteal artery given off at the lower border of the popliteus muscle. शुरू होती है on the back of the leg, एंटर करती है, फ्रंट में पेयर्स करेगी दो हेड्स ऑफ tibialis posterior के बीच में, इंटरॉशियस मेम्ब्रेन को पेयर्स करेगी, फिर एंटीरियरली आएगी, एंटीरियरली सीधा वर्टिकली नीचे जाएगी मीडियल और लेटरल मेल्यूलस के बीच में. उसके बाद फुट में आ जाएगी, फुट पे इसी आर्टरी का एंटीरियर टिबियल आर्टरी का नाम चेंज हो जाएगा और बनेगा डॉर्सालिस पेडिस आर्टरी. ठीक है. ये डॉर्सालिस पेडिस आर्टरी आगे जाती है और फर्स्ट और सेकंड टो के बीच में जो वेब स्पेस है वहां पे ये टर्मिनेट हो जाती है. ठीक है. Now, the relations. This is an important diagram. ये आप लोग एग्जाम में बनाएंगे. अगर आप लोग रिलेशंस नहीं भी लिखेंगे, ये रिलेशंस आपकी इसमें कवर हो जाती है. ठीक है. सो अगर हम देखेंगे, we can divide the relations of this anterior tibial artery into three parts. The relations in the upper 1/3 of the leg, middle 1/3 of the leg, and the lower 1/3 of the leg. In the upper 1/3 of the leg, you can see that this artery lies between this muscle, that is the tibialis anterior muscle, and this muscle. This muscle is the extensor digitorum longus muscle. Then in the middle 1/3 of the leg, it lies between the tibialis anterior muscle and the extensor hallucis longus muscle. And then lower down, lower 1/3 here, you see this is the tendon of extensor hallucis longus and this is the tendon of the extensor digitorum longus. So this is the relation in the upper 1/3 between the tibialis anterior muscle. Muscles have already been discussed, and the extensor digitorum longus. In the middle part, it lies between the tibialis anterior muscle and the extensor hallucis longus, and lower down it lies between the extensor hallucis longus and the extensor digitorum longus muscle. Okay. Now, easy artery है, ना कुछ उसमें है नहीं, ये artery आई. ठीक है. This is a diagram that you will make in the exam. It gives what are the branches of this artery. It gives an anterior tibial recurrent artery and ऐसी पीछे जाएगी posterior tibial recurrent artery. Both these arteries, ये नाम आपने सुने होंगे जब हम लोगों ने anastomosis around the knee joint पढ़ा. ठीक है. उसके बाद obviously there are some muscles here, so it will give some muscular branches, and then we have the anterior medial malleolar artery and an anterior lateral malleolar artery. These two arteries take part in anastomosis around the medial and the lateral malleolus. Okay. Sometimes what happens is that the anterior tibial artery fails to grow downwards. इसका कोर्स छोटा रह जाता है. ठीक है, उस कंडीशन में क्या हो जाता है, द डोर्सालिस पेडिस आर्टरी अराइजेस फ्रॉम द परफोरेटिंग ब्रांच ऑफ द पेरोनियल आर्टरी which is a branch of the posterior tibial artery. Okay. Now, so this is a diagram. You can see this is the anterior, right anterior tibial artery. This is the interosseous membrane. So इससे पहले ये posterior थी. Interosseous membrane को pass करते हुए anteriorly आ गई. ये इसके relation जो मैंने बताया, tibialis anterior extensor digitorum longus, tibialis anterior extensor hallucis longus, और नीचे extensor hallucis longus and extensor digitorum longus. ब्रांचेस देती है, मस्कुलर ब्रांचेस इन तीनों मसल्स को, ठीक, ब्रांचेस एंटीरियर टिबियल, एंटीरियर पोस्टीरियर टिबियल रिकरेंट, एंटीरियर लेटरल मीडियलस एंड एंटीरियर लेटरल एंड एंटीरियर मीडियल मेल्युलर ब्रांच. नीचे जाके यही आर्टरी कंटिन्यू करती है ऑन द फ्रंट एंड यही हमारी डोर्सालिस पेडिस आर्टरी बनती है. ओके, नाउ टॉकिंग अबाउट द डीप पेरोनियल नर्व. The main nerve of the interior compartment and the dorsum of the foot is the deep peroneal nerve. This nerve corresponds to the posterior interosseous nerve of the forearm. So here you can see this. Here we have a common peroneal nerve. So it's a branch of the common peroneal nerve. It passes through the substance of the peroneus longus muscle, and then at the lateral side of the fibula, it divides into two branches. We have a deep peroneal nerve and we have a superficial peroneal nerve. So it is a branch of one of the terminal branches of the common peroneal nerve that is given off at the neck of the fibula. So आप क्या लिखेंगे? पेरोनियस लॉन्गस मसल के पास ही शुरू हो जाती है, उसके बाद ये एंटीरियर कंपार्टमेंट ऑफ लेग में आ जाती है. ठीक है, उसके बाद ये क्या करती है, इट रन्स अलोंग विद द एंटीरियर tibial artery. Now in the leg, if we see it accompanies the anterior tibial artery. The nerve lies lateral to the artery in the upper 1/3 and in the lower 1/3. दोनों में ये lateral lie करती है, whereas in the middle 1/3 the nerve hesitates to cross over the artery. Yani it is trying to cross over the artery from lateral to medial side, but it does not cross the artery and it comes back to the lateral side. Because of this course, it is also known as the nervous hesitance. This is a viva question. Okay, nervous hesitance. Why? Because ये hesitate कर रही है, ये cross नहीं करती है इसको. ठीक, then this nerve, when you see here, sorry, here, then this nerve goes and divides into a medial and a lateral terminal branch. So this is the artery. It goes and divides into a medial and a lateral terminal branch. The lateral terminal branch runs laterally and ends in a pseudoganglion that lies deep to this muscle, which is the extensor digitorum brevis muscle, which is the only muscle that is intrinsic muscle of the dorsum of the foot. मतलब जो यहीं से ओरिजिन करता है यहीं इंसर्ट करता है. ठीक है, सो दिस इज द मसल जो काटा गया, दिस इज द एक्सटेंसर डिजिटोरम ब्रेविस. यहाँ पे क्या होता है, द डीप पेरोनियल नर्व डिवाइड्स इनटू टू ब्रांचेस, अ medial branch and a lateral branch. The important viva question is that this lateral branch goes and ends as a pseudoganglion. Okay, this lies on the lateral side of the foot deep to the extensor digitorum brevis muscle. Then this medial branch, the medial branch runs forward and ends by supplying the skin of the first interdigital cleft का जो skin होता है between the first and the second metatarsal bones. Okay, so यहाँ पे the important question, दो viva questions जो important है वो क्या है. एक, सबसे पहले ये ब्रांच किसकी है, तो ये कॉमन पेरोनियल की ब्रांच है. कहाँ पे दी जाती है, लेटरल साइड ऑफ द नेक ऑफ द फिब्यूला पे दिया जाता है, एंटीरियरली आती है. इसको नर्वस हेजिटेंस भी कहते हैं. ठीक है, क्यों हेजिटेंस कहते हैं, बिकॉज इट्स ट्राइंग टू क्रॉस द एंटीरियर टिबियल आर्टरी फ्रॉम लेटरल टू मीडियल साइड, बट इट डज नॉट क्रॉस इट. राइट, एक चीज. दूसरी चीज, मैंने आप लोगों को एग्जाम अपर लिम्ब के डायसेक्शन में भी बोला था कि आपसे पूछा जाता है कि व्हाट आर द डिफरेंट नर्व्स दैट एंड एज स्यूडोगैंग्लियन. ठीक है, सो ऊपर आप लोगों ने एक्सिलरी की ब्रांच में देखा था, यहाँ पे आर्म में और आप लोगों ने पोस्टीरियर इंटरॉशियस नर्व देखी थी, और फुट में आप लोग देखते हैं कि लेटरल ब्रांच ऑफ द डीप पेरोनियल नर्व एंड्स एज अ स्यूडोगैंग्लियन. Okay, so what are the different branches it gives? The branches that are given here are, we know that it's the main artery that the main nerve that supplies the muscles of the interior compartment. So the muscles of the interior compartment, the four muscles of the interior compartment, that is the extensor digitorum, will be supplied by it. The extensor digitorum brevis, that is on the dorsum of the foot, will be supplied by it. And because this nerve is going down and it is lying between the first digital cleft, so yahan pe jo muscle hoga, that is the first dorsal interosseous, that will be present on the sole of the sole of the foot, will be supplied by this. Cutaneous branches. Cutaneous branch, we know that it supplies the skin of the first interdigital cleft. So this finishes your the anterior tibial artery and the deep peroneal nerve. Now talking about the dorsum of the foot. See, this diagram, this sensory innervation of the dorsum of the foot is very important. I have already discussed it in the cutaneous supply of the anterior compartment as well. But here we can see on the dorsum of the foot, the main nerves we see are the superficial peroneal nerve. The superficial peroneal nerve, it supplies the sensory innervation of most of the dorsum of the foot, except the skin between skin of the cleft between the first and the second toe. Okay. It also supplies the medial margin of the great toe. This one. So major part dorsum of the foot, ये dorsum होता है, plantar aspect नीचे से होता है. Dorsum of the foot का major aspect जो है, that is supplied by the superficial peroneal nerve. ठीक है. Now अब किस part को supply नहीं करता है? It does not supply the skin over the cleft between the first and the second toe, जो कि deep peroneal nerve supply करती है. It does not supply the skin over the lateral aspect of the foot, that is supplied by the sural nerve and the saphenous nerve. The saphenous nerve supply करती है medial margin of the dorsum of the foot up to the ball of the great toe. Okay, so this you have to remember. Now, talking about the muscles of the dorsum of the foot. Now, the muscles of the dorsum of the foot, basically, यहाँ पे जब हम लोग foot का dissection करते हैं, तो हम लोगों को कुछ tendons दिखते हैं. Muscle हम लोगों को एक ही दिखता है. जो एक muscle bulk हम लोगों को दिखता है, that is the intrinsic muscle. The intrinsic muscle, we have only one intrinsic muscle, that is the extensor digitorum brevis, जिसके नीचे मैंने अभी आप लोगों को बोला कि lateral branch pseudoganglion देती है. ठीक है. और बाकी जितने muscles हम लोगों को दिखते हैं, वो सब tendons होते हैं. Extrinsic tendons हैं, जो muscles anterior compartment के muscles के tendons होते हैं. ठीक है. Now, this extensor digitorum brevis muscle जो होता है, it is a small muscle. It is situated on the dorsum of the foot. It arises from the anterior part of the superior surface of the calcaneum. This is the calcaneum. So calcaneum के superior surface से आता है. The muscle moves down. It divides into four tendons for the medial four toes. The tendon of the big toe crosses in front of the dorsalis pedis artery. Now, the lateral three tendons join the ये जो lateral three होते हैं, ये cross करता है और ये जाता है और ये supply करता और ये insert होता है the dorsal surface of the proximal phalanx of the great toe. ठीक है. So basically ये arise करता है calcaneum के superior surface से. Then it divides into four tendons for the medial four toes. The medial most tendon अलग निकलता है and it is inserted into the proximal phalanx, so the base of the proximal phalanx, whereas the rest of the lateral three tendons, they go and they join the lateral surface or lateral side of the tendon of extensor digitorum longus muscle, जो कि जाके second, third और fourth. ठीक है. ये ग्रीन जो है ये एक्सटेंसर डिजिटोरम लॉन्गस का टेंडन है जिसका इंसर्शन हम लोग देख चुके हैं. तो ये जाके लेटरल साइड पे लगता है. ओके. समटाइम्स ये वाला जो है मीडियल मोस्ट पार्ट एक्सटेंसर डिजिटोरम ब्रेविस का, जो कि अलग टेंडन होता है, इसको हम लोग एक्सटेंसर हैलिसिस ब्रेविस भी कहते हैं. Extensor hallucis brevis is nothing, it's not a different muscle, it is a medial most part of the extensor digitorum brevis muscle. Okay, this will be supplied by, you know, that the lateral terminal branch of deep peroneal nerve passes deep to it, so it is supplied by that muscle. क्या काम होगा? यहाँ जाएगा, so it extends the metatarsophalangeal joint of the great toe. The other three tendons, metatarsophalangeal joints, को करेगा साथ में, because they are inserted into this tendon. इनके through they will also have action of dorsal. Sorry, other three extend करते हैं ये क्या करेंगे? ये इसको भी करेंगे और interphalangeal joints को भी extend करेंगे. Now, talking about the dorsalis pedis artery. अब I told you that the anterior tibial artery continues downwards और उसका नाम change हो जाता है और वो dorsalis pedis artery कहलाई जाती है. This is the chief artery of the dorsum of the foot, continuation of the anterior tibial artery in front of the ankle joint. So as you can see here, it moves downwards. It reaches the part of the proximal first metatarsal space. Then it dips down and enters the sole of the foot. Sole of the foot में जाके ये continue करती है और एक anastomosis with the lateral plantar artery. Okay. Okay. Now, so what are the different branches of this artery? We have a lateral tarsal artery. We have medial tarsal arteries. They take part in anastomosis around the lateral and the medial meatus. Then we have this artery, that is the arcuate artery. This arcuate artery arises near the base of the second metatarsal bone. Then it passes laterally with a convexity towards the other toes and reaches the lateral side of the foot. Now, during its course, it gives off 3 branches, which are the 3 dorsal metatarsal arteries. Second, third, and fourth dorsal metatarsal artery. These dorsal metatarsal arteries then go, these are the dorsal metatarsal arteries, okay? They go and then they divide into 2 branches, which supply the adjacent side of 2 toes. Dobara. ये anterior tibial artery continue करती है, it crosses the ankle joint, and then its name changes and it becomes the dorsalis pedis artery. This dorsalis pedis artery goes down and at the first interdigital cleft, it moves downwards and enters the sole, and there it forms an anastomosis along with the lateral plantar artery. Now, what are the branches? We have lateral tarsal artery, we have medial tarsal arteries, we have this artery that is the arcuate artery. It passes with a convexity towards the lateral side. This arcuate artery in turn gives 3 branches, which are the dorsal metatarsal arteries. ये dorsal metatarsal arteries नीचे आती हैं और 2 branches में divide करती हैं, जो कि adjacent side of different toes को supply करती है. So this is the second, third, and the fourth metatarsal artery, dorsal metatarsal artery. What about the first dorsal metatarsal artery? The first dorsal metatarsal artery directly comes from the dorsalis pedis artery before it dips into the sole. उससे पहले, sole में जाने से पहले, end होने से पहले ये branch देती है. This is the first dorsal metatarsal artery. ये dorsal metatarsal artery आगे जाके 2 branches में divide करती है, जो कि adjacent side of great toe और second toe को supply करेगी. Okay. Now, there is a clinical condition. What is the clinical importance of this dorsalis pedis artery? We palpate this artery when we check the peripheral pulses. So we have seen femoral artery देखते हैं, popliteal artery देखते हैं, और ये dorsalis pedis artery हम लोग देखते हैं. और ये हम लोग peripheral pulses किस में देखते हैं? Normally हम लोग देखते हैं जब कुछ vaso-occlusive diseases होते हैं, जैसे कि हमारी Berger's disease होती है. But we have to remember one thing, that it can be congenitally absent in 14% of the cases. ये चीज नहीं मिलेगी. Okay. Now, so these are the different diagrams. So this is the dorsalis pedis artery. ये भी वही diagram है जो आप लोगों को पूरा दिखाएगा. Interior, you can make this diagram as well. ये anterior tibial artery कैसे cross होती है, जो relations मैंने आप लोगों को बताई, उसकी different branches बताई. फिर ये आप लोगों की dorsalis pedis artery, उसकी different branches. Okay. Now, coming to the lateral compartment of the leg. The lateral compartment of the leg, we have some muscles, arteries, and we have the nerve. The muscles in the lateral compartment, we have 2 muscles. We have the peroneus longus muscle and we have the peroneus brevis muscle. The main nerve that supplies these muscles is the superficial peroneal nerve. The lateral compartment of the leg does not have its own arterial supply. The contents that are present in the lateral compartment of the leg are supplied by branches of the peroneal artery, which reaches the lateral compartment by flexor hallucis longus and posterior intermuscular septum को pairs करती हुई. ठीक है? Now, talking about the peroneal retiniculum. Peroneal retiniculum, as you have seen, the retiniculum in different parts of the body. These are thickened bands of deep fascia that are present. What do? They keep them. They keep the tendons in place and they prevent their bowstringing action. Okay. So the peroneal retiniculum, there are two thick bands of deep fascia that are present on the lateral side of the ankle joint. And which are the muscles that they support? They support two muscles. We have the peroneus longus muscle and the peroneus brevis muscle. We have two peroneal retiniculum. We have a superficial peroneal retiniculum and we have a superior peroneal retiniculum and an inferior peroneal retiniculum. The superior peroneal retiniculum is a thickened band of deep fascia that is present behind the lateral malleolus. This is your lateral malleolus. इसके पीछे प्रेजेंट होता है. When we look at the attachment, ऊपर easy way to remember is ऊपर तो हमारा lateral malleolus पे attach होता है और नीचे हमारा ये attach होता है lateral surface of calcaneum. ठीक है? So anteriorly it is attached to the back of the lateral malleolus, whereas posteriorly it is attached to the lateral surface of the calcaneum. Here you can see there is the tendons of this is the tendon of peroneus brevis and this is the tendon of peroneus longus muscle. So the tendon of both peroneus longus muscle and the peroneus brevis muscle, they pass through the retiniculum in a single compartment. The tendon of peroneus longus, if you see, it lies superficial to the tendon of peroneus brevis muscle, and both of these here are enclosed in a common synovial sheath. Okay, so thickening of deep fascia present on the lateral side of the lateral malleolus, anteriorly attached to the lateral malleolus, posteriorly attached to the calcaneum, keeps the peroneus longus and brevis in position. When we look at the peroneus longus and brevis lies superficial to the brevis, and both of them are enclosed in a common synovial sheath. Looking at the inferior peroneal retiniculum, the inferior peroneal retiniculum is again a thickening of the deep fascia. This is superiorly attached to the anterior surface of the anterior part of the superior surface of the calcaneum, whereas inferiorly it is attached to the lateral surface of the calcaneum. But when we look at it, यहाँ पे कहीं attachment होता है. In between it, we have a projection that is known as the peroneal trochlea. So जो tendon होता है वो एक साथ नहीं जाते बल्कि वो दो parts में divide हो जाते हैं. ठीक है? So दो loops बनते हैं. One loop is for the tendon of the peroneus brevis, whereas the other loop is for the tendon of the peroneus longus muscle. जो peroneus brevis का होता है, the tendon of peroneus brevis, it passes through the superficial loop peroneus longus का inferior loop से pass होता है. Each tendon is enclosed in its own synovial sheath. Here. So this you have to remember that superior peroneal retiniculum के नीचे दोनों एक ही शीट में आते हैं. नीचे peroneal trochlea होता है जिसकी वजह से दो अलग शीट्स में जाते हैं. नीचे से ये क्वेश्चन आपसे अभी हम लोग कैल्किनियम जो पढ़ेंगे तब आपको बोलूंगी मैं ये कि peroneal trochlea के नीचे से कौन सा टेंडन जाता है, peroneal trochlea के ऊपर से कौन सा टेंडन जाता है, ये पूछा जाता है. So peroneal trochlea के ऊपर से जाता है हमारा peroneus brevis छोटा वाला और peroneus longus लंबा वाला जो है वो peroneal trochlea के नीचे से जाता है. ठीक है? This is the superior peroneal retiniculum. This is the inferior peroneal retiniculum. Here you can see this is the peroneus brevis. This is the peroneus longus muscle. ये जा रहा है, ये पीछे जाएगा और 11 वाला जो है ये कंटिन्यू करेगा आगे की तरफ. ठीक है? Okay. Now coming to the muscles, we have two muscles here. We have the peroneus longus muscle and we have the peroneus brevis muscle. Okay. Now the peroneus longus muscle, here you can see that it arises from the upper 2/3 of lateral surface of the shaft of the fibula. हर एग्जाम में ऐसे ही डायग्राम बनाना, फिर लिखने में if you don't get time to write anything, डायग्राम सारा कवर कर लेता है. ठीक है? Okay. So here you can see that it arises from the upper 2/3 of the lateral surface of shaft of fibula. It also arises from the adjacent part of head of fibula. Okay, so head of fibula and upper 2/3 of the lateral surface of shaft of fibula. And as you can see here, we have the common peroneal nerve, जो मैंने आप लोगों को बोला, it crosses the substance of the peroneus longus muscle. So दो origins के बीच में से ये pass होता है. When we look down, we have a muscle, it forms a long tendon. The long tendon, as you can see here, it lies superficial to the peroneus brevis muscle. Then it passes downwards through the groove on the posterior surface of the lateral malleolus under the superior peroneal retinaculum. Then it passes inferior to the peroneal trochlea. Peroneal trochlea के नीचे से pass होता है. इसके बाद क्या करता है ये? On reaching the bone, this is the cuboid bone. On reaching the cuboid bone, the tendon changes its direction. It passes through this tunnel on the cuboid bone and then reaches the plantar surface of the cuboid bone. ये हम inferiorly देखते हैं, ठीक है? दोबारा मैं repeat करूंगी. Then पहले ये देख लो, ये cuboid की surface पे एक tunnel बनती है, उसको cross करता हुआ जाता है. It then crosses the sole of the foot obliquely from lateral to medial side, and then it is inserted into the base of the first metatarsal bone and the adjacent medial finiform. Here and here. Okay, dobara. So we said that this muscle is the peroneus longus or the fibularis longus muscle. It arises from the head. It arises from the upper 2/3 of the shaft of the fibula. It forms a long tendon. This long tendon lies superficial to the peroneus brevis muscle. It passes through a groove on the posterior surface of the lateral malleolus. It passes through the superior retinaculum. Then inferiorly, when it reaches the inferior retinaculum, it passes below the peroneal trochlea. Then here, ये peroneal trochlea दिख रहा है, इसके inferiorly आया. Then it reaches the cuboid bone. On the lower surface of the cuboid bone, we have a tunnel. It passes through this tunnel of the cuboid bone. It changes its direction. अब ये obliquely जाता है from the lateral to the medial side. Obliquely cross करता है और जाके लगता है हमारे first metatarsal के infero-lateral side से और medial cuneiform के infero-lateral side से. ठीक है, दिस इज वेरी इंपॉर्टेंट. ये कैसे इसका इंसर्शन होता है, ये इंपॉर्टेंट है. वाई? क्योंकि सीधी सी बात है, इसके मसल मैं अभी बताती हूँ, इसके एक्शन के लिए ये मसल अगर ऐसे जाके क्रॉसली जाके वहां लग रहा है, मीडियली लग रहा है ना, यहाँ लग रहा है, तो इसका एक्शन क्या होगा? इसका एक्शन ये होगा, ये इवर्टर होगा. दिस इज हाउ इन्वर्जन occurs, right? So यहाँ से मसल आ रहा था, क्रॉस कर रहा था और यहाँ लग रहा था नीचे से. So जब ये कॉन्ट्रैक्ट करेगा, ये मसल को इवर्ट करेगा, ये फुट को इवर्ट करेगा. वेरी इंपॉर्टेंट. ओके, I hope it is clear. The peroneus longus is supplied by which nerve? The superficial peroneal nerve. It is a chief everter of the foot. The chief everter. ये एग्जाम में करने को बोलते हैं, इन्वर्जन दिखाइए और इवर्जन दिखाइए. So this is eversion. कैसे होता है? यहाँ से मसल जा रहा है, क्रॉस कर रहा है और मीडियल साइड में लग रहा है. जब ये कॉन्ट्रैक्ट करेगा, ये इसको अपनी तरफ खींचेगा, ये पोर्शन जो है लेटरल पोर्शन, ये लिफ्ट हो जाएगा. दिस इज eversion. Okay, so this is the chief everter of the foot. At the same time, because इसका fully action हो जाता है, तो हम बाद में पढ़ेंगे arches में, it maintains the lateral and the medial longitudinal arches of the foot. Okay, now talking about another muscle, that is the peroneus brevis muscle. The peroneus brevis muscle, it is a small muscle. It arises from the lower 2/3 of the lateral surface of the shaft of the fibula. The muscle converges to form a tendon. This tendon passes behind the lateral malleolus through this, and then it passes through the superior part of superior to the peroneal trochlea. Okay, then here it goes down and it is inserted into the lateral side of the base of the fifth metatarsal bone. The lateral side of the base of the fifth metatarsal bone. It is also a chief everter of the foot, and it maintains the longitudinal arch. Okay. Okay. Now, we know that we have inverters of the foot. Sorry. And we have some everters of the foot. I hope. So we have inversion of the foot, we have eversion of the foot. There are some muscles which are inverters of the foot, and then there are few muscles which are the everters. Now, अगर इनमें से किसी का भी ओवर एक्शन होगा तो क्या हो? Okay, so there are few deformities of the foot that occur due to overactivity of either the inverters or the everters of the foot. If there is an injury, जैसे हम लोगों ने अभी पढ़ा, the peroneal muscles, these are supplied with the superficial peroneal nerve. So if the superficial peroneal nerve is damaged, then what will happen? There will be an overactivity of the inverters of the foot, because everters of the foot are paralyzed. These everters of the foot, जो peroneal longus है और peroneus brevis है, ये main everters, ये supplied है superficial peroneal nerves. ठीक है? अगर सुपरफिशियल पेरोनियल नर्व डैमेज हो जाती है तो इनका तो एक्शन पैरालाइज हो जाएगी, ये काम नहीं करें. ओवर एक्टिविटी किसकी हो जाएगी? ओवर एक्टिविटी हो जाएगी इन्वर्टर्स, क्योंकि बैलेंस चलता है. इवर्जन और इन्वर्टर्स दोनों बैलेंस चलते हैं, राइट? सो उस कंडीशन में हमारे पास फुट में ये डिफॉर्मिटी हो जाएगी, क्योंकि इन्वर्टर्स ऑफ द फुट जो है वो ओवर एक्टिव होगा, तो फुट इन्वर्जन के पोजिशन में होगा. दिस इज नोन एज टैलेपस वैरिस. Now, if there is a damage to the deep peroneal nerve, then the everters of the foot will be paralyzed. यहाँ का एक्शन खत्म हो जाएगा. So foot will be in which position? In eversion के position में. इसको talipus valgus कहते हैं. Now, coming to the nerve that is the superficial peroneal nerve. The superficial peroneal nerve is the main nerve of the main nerve that supplies the muscles of the lateral compartment. We have seen that this is one of the terminal branches of the common peroneal nerve. This is given off at the level of the neck of the fibula in the substance of the peroneus longus muscle. Okay. It then descends downwards between the peroneus longus and the peroneus brevis muscle. Then the important thing is that at the junction of the upper 2/3 and lower 1/3, it passes the deep fascia, and then it goes and divides into medial and lateral branches. इतना ही आप याद रखोगे. Common peroneal की branch है, आप याद रखोगे lateral surface और lateral side of the neck of the fibula पे दी जाती है, peroneus longus के main bulk में दी जाती है, फिर नीचे जाके divide करती है at the level of upper 1/3 and lower 2/3 के junction पे ये divide करती है हमारे पास, सॉरी upper 2/3 और lower 1/3 के junction पे medial और lateral branches में, जो कि dorsum of foot में जाते हैं, जो आपने cutaneous branches देखी थी. जब हम लोग इसके muscular supply की बात करेंगे, the muscles that are supplied by it, we have the peroneus longus and the peroneus brevis that are supplied by it. Then we have some cutaneous branches. The cutaneous branches I've already discussed that they go and they divide. एक तो यहाँ पे इस part को supply करेगी, that is it supplies the skin of the lower 1/3 of the lateral side of the leg. And then on the dorsum of the foot, it gives a medial branch and a lateral branch. The medial branch divides into two dorsal digital nerves, one for the medial side of the great toe. Here you can see medial side of the great toe, and the other for the second interdigital cleft. ये जाती है, ये इसको देती है और second interdigital cleft को देती है, क्योंकि first interdigital cleft को deep peroneal nerve supply करेगी. ठीक है? So superficial peroneal nerve की जो medial branch है और lateral branch है, medial branch जो है इसकी, ये देगी दो branches. एक जाएगी medial side of great toe पे और दूसरी जाएगी second interdigital cleft पे, ना कि first interdigital cleft पे. ओके? जो लेटरल ब्रांच होगी वो डिवाइड करेगी, ये है लेटरल ब्रांच, वो जाएगी और डिवाइड करेगी दो डॉर्सल डिजिटल नर्व्स फॉर द थर्ड एंड द फोर्थ इंटरडिजिटल क्लेफ्ट. नाउ सीधी सी बात है. So this is the diagram which I've already discussed. Now, what happens if there is an injury to the superficial peroneal nerve? If there is an injury to the superficial peroneal nerve, there will be what? Loss of eversion of the foot, because the main everters of the foot are paralyzed. There will be a sensory loss over which parts? These parts, a lateral part of the leg and on the dorsum of the foot, except the areas that are supplied by the sural, the deep peroneal, and the saphenous nerve. Okay. Now, coming to the medial side of the leg. Medial side of the leg में कुछ नहीं है, बस तीन चीजें याद रखनी है. Medial side of the leg जो है mostly ये हमारे पास जो है ये subcutaneous है, except the upper part of the tibia. On the medial side, at the upper part of the tibia, we have few attachments which you have to remember. We have the tibial collateral ligament. The tibial collateral ligament, which I've already discussed in adductor compartment, which when I said that this represents the degenerated tendon of the adductor, the hamstring part of the adductor magnus muscle. Then we have three attachments here. We have the tendons of sartorius, gracilis, and the semitendinosus muscle. All these muscles, they represent the muscle of 3 different compartments of the thigh. You know, sartorius किस compartment का है? Anterior compartment का है, supplied by the femoral. Gracilis, medial compartment का है, supplied by the obturator. And semitendinosus, जो है, that is from the posterior compartment, that is supplied by the sciatic. Okay, so ये 3 muscles हैं. इसके अलावा lower down, it is, we have the great saphenous nerve, saphenous vein, and we have the saphenous nerve here. Okay, now when you look at this, so मैंने कहा 3 different compartments से आ रहे हैं. जो 3 different compartments से आ रहे हैं, therefore they take origin from 3 different parts of the hip bone. Okay, so they take origin from 3 different parts of the hip bone, but lower down when we see, they are attached to a common point. So the lower end of these muscles is attached to one point. For this arrangement, it looks like that these muscles act as guy ropes. जैसे for instance tent को जो चीज support करती है, ठीक है? So इनको हम लोग क्या बोलते हैं? These are known as guy ropes. Guy ropes से पूछा जाता है आपसे guy ropes में कौन-कौन से muscles आते हैं? So 3 है, sartorius, gracilis, and the semitendinosus muscle. Okay. इसके अलावा we have an important bursa here that is known as the bursa anserinus. This bursa anserinus. It is a large, complicated bursa, and it separates the tendons of sartorius, gracilis, and the semitendinosus from each other near the insertion, as well as it separates these muscles from the tibial collateral ligament. There may be an inflammation of this bursa when it is known as anserin bursitis. So this finishes your anterior, lateral, and the medial compartment of leg. Thank you.